Protecting patient privacy and information security in healthcare. Understanding confidentiality in healthcare. Confidentiality represents a fundamental obligation to protect patient health information from unauthorized access and disclosure. Definition: the obligation to protect patient health information from unauthorized individuals or entities. Purpose: builds trust between patients and healthcare providers while ensuring legal compliance. Benefits: protects patients from identity theft, discrimination, and privacy violations. Legal foundation: supported by federal and state laws governing healthcare information. HIPAA regulations and requirements. The Health Insurance Portability and Accountability Act provides comprehensive protection for patient health information. HIPAA overview. Enacted in 1996 to establish national standards for health information protection. Privacy rule controls who can access and share protected health information. Security rule requires safeguards for electronic protected health information. Applies to hospitals, clinics, nursing facilities, healthcare providers, insurers, and billing companies. Protected health information, PHI. Understanding what constitutes protected health information helps nurses maintain appropriate confidentiality standards. PHI includes names, dates of birth, and social security numbers, medical histories, diagnoses, and treatment information, test results, medications, and procedure details, insurance information and billing records. PHI can only be shared when patient provides written authorization for disclosure, required by law such as abuse reporting or public health emergencies, necessary for treatment, payment, or healthcare operations. Patient rights under HIPAA. Patients possess specific rights regarding their health information that nurses must respect and support. Patient rights include access and request copies of their medical records, request corrections to inaccurate health information, know who has accessed their protected health information, file complaints if privacy rights are violated, request restrictions on how their information is used, choose how they receive health information communications, confidentiality in different communication methods. Various communication methods require specific approaches to maintain confidentiality and information security. Verbal communications. Avoid discussing patient details in public areas such as elevators or cafeterias. Use private spaces for patient-related conversations. Lower voice when discussing sensitive information. Written communications. Store paper records in locked cabinets when not in use. Avoid leaving patient information visible on desks or counters. Use secure fax machines and verify recipient information. Electronic communications. Use strong passwords and log out when workstations are unattended. Access only information necessary for patient care. Use encrypted systems for email and electronic transmission. Phone communications. Verify patient identity before sharing information. Use private areas for phone consultations. Confirm you are speaking with authorized individuals. Electronic health records security. Electronic health record systems require specific security measures to protect patient information effectively. EHR security advantages. Faster and more efficient documentation processes. Improved access to patient information for authorized users. Reduced risk of errors through automated systems. Better coordination among healthcare team members. Security measures. Use unique logins and create strong, complex passwords. Log out immediately when leaving workstations unattended. Access only information necessary for direct patient care. Report suspicious activity or security breaches immediately. Participate in regular security training and updates. Preventing confidentiality breaches. Understanding common causes of breaches helps nurses implement effective prevention strategies. Common causes of breaches. Discussing patient information in public areas or social settings. Leaving patient charts open and unattended in work areas. Sharing passwords or allowing others to use personal logins. Sending unencrypted emails containing protected health information. Accessing records of patients not under your direct care. Prevention strategies. Follow HIPAA guidelines consistently in all situations. Think carefully before sharing any patient-related information. Use secure communication channels for all patient data. Report potential breaches immediately to supervisors. Social media and confidentiality risks. Social media presents unique challenges for maintaining patient confidentiality in healthcare settings. Prohibited social media activities. Never share patient stories, photos, or information online. Avoid discussing patient details even without identifying names. Do not post complaints about work or colleagues publicly. Never share facility information that could compromise security. Professional guidelines. Remember that private posts can become public information. Employers actively monitor social media accounts of employees. Violations can result in immediate termination and legal consequences. Maintain professional boundaries in all online interactions. Handling information requests. Nurses frequently receive requests for patient information and must respond appropriately to maintain confidentiality. Authorized access. The patient or their designated legal guardian. Healthcare team members directly involved in patient care. Law enforcement with proper legal authorization. Public health agencies for disease surveillance and reporting. Unauthorized requests. Employers without specific patient consent. Family members without proper authorization from patient. Media representatives or journalists seeking information. Curious individuals not involved in direct patient care. Consequences of confidentiality violations. Violating patient confidentiality carries serious legal, professional, and personal consequences. Legal consequences. Fines up to $1.5 million for serious HIPAA violations. Civil lawsuits from affected patients and families. Criminal charges in cases of intentional violations. Professional consequences. Immediate termination from employment. Disciplinary action by state nursing boards. Loss of nursing license and professional credentials. Difficulty obtaining future healthcare employment. Personal consequences. Loss of trust from patients, colleagues, and supervisors. Damage to professional reputation and career prospects. Financial burden from legal fees and penalties. Proper documentation practices. Documentation serves as both a communication tool and legal protection while requiring confidentiality safeguards. Documentation requirements. Record only factual, objective information about patient care. Use legible handwriting or electronic systems consistently. Correct errors properly without erasing or using correction fluid. Sign and date every entry with appropriate credentials. Keep patient charts secured and protected at all times. Legal protection. Accurate documentation provides evidence of appropriate care. Missing documentation may be interpreted as care not provided. Falsifying records constitutes illegal and unethical behavior. Summary and professional commitment. Confidentiality represents both a legal duty and ethical responsibility for all nursing professionals. HIPAA protects patient information and ensures privacy rights, while nurses must use secure documentation and communication methods consistently. Breaches of confidentiality carry serious consequences, including legal penalties and loss of professional credentials. Key takeaways for practice. Confidentiality is fundamental to patient trust and safety. HIPAA regulations provide comprehensive protection guidelines. Technology requires specific security measures and careful use. Professional integrity depends on maintaining strict confidentiality. Thank you for learning about confidentiality and information security. Your commitment to protecting patient privacy builds trust and maintains the integrity of healthcare relationships.